Good morning, my name is Elena Tejada and I'm gonna be reading Professional English ENIOS, Unit 5 to 13. Medical Practitioners 1. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council's list or register, in order to practice. A doctor who treats patients, as opposed to one who only does research, is called a clinician. A doctor who provides primary care for patients is known as general practitioner or family doctor. GPs usually work in a group practice. Large group practice work in a building called a healthcare. Note: in British English, the verb is spelled practice, and the noun is spelled practice. In British English, the verb is spelled practice with S, and then the noun is with C. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the NHS, providing private healthcare, might have consulting rooms outside a hospital. For example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Mrs. So, Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist specializes in diseases of the heart and circulation, or cardiology. A geriatrician specializes in diseases of elderly patients, or geriatrics. An anesthesiologist is in specialty in anesthesia. Note: names of specialties usually end in ology. Names of specialties usually end in ologist. If the name of a specialty ends in es, the name of the specialist ends in ician. There are some exceptions: anesthetic and anesthetist. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide. But I'm quite attached to the idea of pediatrics because I like working with children. I had certainly preferred to work with children than, say, elderly patients. So I don't fancy geriatrics. I was never very interested in detailed anatomy. So the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I have assisted at operations several times and I have been done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like trying off carditis and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not the right for me. Note: the collocation "good with" is followed by a noun. He's good with children. The combination "get at" is followed by the ing from June of a verb or by a noun. She's good at explaining procedures. She's good at explanations. Thank you. Medical Practitioners 2, Unit 6. Hospital Staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of four main groups: A pre-registration house officer or house officer is a newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor. A senior house officer is in the second year of postgrad training. The title is now Foundation Year 2 Doctor. But the old term Senior House Officer and SHO are still used. A specialist register is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registered doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams, which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward, where they will receive treatment and care. The junior doctor clears them, takes their medical history, and examines them. Sometime later, the registrar also sees the patient and may order investigation or test. For example, X-rays or an ECG. Make a provisional diagnosis and begin treatment. The consultant usually sends the new admissions, people who have recently been admitted to the ward, for the first time on one of the regular ward rounds, when the management of the patients is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. Shift. Junior doctors now normally work in shift, which means they normally work for 8 hours every day, for example, 3 a.m. to 3 p.m., and are then free until 7 a.m. the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, available to return to the hospital if necessary. From 5 p.m. to 9 a.m. the next day, days on call are set out in a rota or a list of names and times. Doctors on call carry a radio pager or a bleeper, a device which make a noise when someone is trying to contact them. Thank you. Nurses. Unit 7. Nursing grades. Nurses working in a hospital have the following grades: a student nurse, a nurse who is still in training; a staff nurse, a nurse who has completed the training course; charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department; nurse manager, a nurse who is in charge of several wards. Note: The old term sister is still sometimes used for a female church nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. Support workers. The clinical support worker who has done a short course and obtained basic qualification, and the nursing auxiliary who is usually unqualified both assist nursing staff. There may also be workers whose duties include making sure patients' notes and information are up to date and answering the telephone. Specialization. Like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes. Health visitors also work in the community, giving advice on the promotion of health and the prevention of illness. The nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressing, giving injections, and removing sutures. Nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following articles demonstrate. Nurses carry out surgery and afford to keep patient waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operation theatre for the first time in an effort to cut patient waiting times. 5 nurses who has passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. The birds perform and carry out are used with all types of procedures. They are often used in the passive form. Perform or carry out an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed by a nurse. The procedure was carried out by a nurse. Allied Health Professionals, Unit 8, Community Health. The health of the community depends on the large number of people other than medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They included the following. Physiotherapists, physios, help people to move by getting them to do exercises or by treating their body with heat or massage. Treating by manipulating muscles and joints with the hands. Occupational therapist, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems. For example, poor housing or unemployment or family problems. Chiropodists, also known as podiatrists, treat conditions affecting the feet. Technicians. Their numbers technicians, people who work with scientific equipment such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service, and ambulance technicians with more advanced qualification is called a paramedic. Prosthetics and orthotists. Prosthetics and orthotists provide care for anyone who needs an artificial limb, a prosthesis, or a device to support or control part of the body, and orthosis. And they also advance on rehabilitation, helping patients return to normal life and work after treatment. Prosthetics provide artificial replacements for patients who had an amputation or were born without a limb. Orthoses provide a range of splints and other devices to aid movement. Correct deformity for an abnormal development of a part of the body, for example, clubfoot, talipes, and relief pain. Opticians test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, they refer the patient to their GP for treatment. The GP may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Hospitals, Unit 9, Introduction to a Hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Baron is introducing him to the hospital. Dr. Baron. The Royal Infirmary is the name of the University Hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatricians. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on the sign. Of course, there are many others, for example, the Intensive Care Unit and the Surgical High Dependency Unit. Jordi, what does outpatient mean? Dr. Baron. Outpatients are the people who come to hospital to attend a clinic or to have tests or treatment, and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can admit it to the day surgery unit. So we got this. Welcome to the Royal Infirmary South Entrance, Car Parks, C&D, visitor and staff, the Simpson Center for Reproductive Health, Gynecology Emergency, Maternity Emergency, and Neonatology Emergency. We got outpatient departments, all wards, day surgery unit, and endoscopy, X-ray department, and combined assessments. So outpatients. Dr. Barrow. The accident and emergency department, also called casualty, is where patients who are actually ill with a certain serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. Inpatients. Dr. Barrow. The inpatient in a hospital are admitted in one of 3 main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternative, their GP might arrange the admission by telephone because they are actually ill, for example, with suspect myocardial infarction, or they are seen in the A&E department, where the doctor on duty working at the time arranged the admission. This would happen in the case of a patient with fractured neck or femur, for example. A larger hospital may have a assessment unit where patients can be admitted temporarily while their condition is assessed. They're assessed. Dr. Ware, yes, decisions are made about their condition and what needs to be done to help them. After treatment is complete, the patient is discharged back to the JP's care. Care Unit 10. The National Health Service. The National Health Service is responsible for health care for everyone in the UK, although a small number choose to pay for private care. Treatment is free, but there is a prescription charge for drugs and appliances, such as cervical collar, with exceptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or JPs, sometimes known as family doctors, nurses, dentists, pharmacists, and obstetricians. JPs work in practices of 1 to 20. Practices are based in a surgery and look after the health of from 1,000 to 15,000 of people in their local community. They also provide health education in areas such as smoking and diet. Run clinics give vaccinations, for example, for influenza, and may prefer minor surgery, such as removal of warts and moles. If a patient needs specialist care, the JP will make a referral, refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their house, or too ill to attend surgery. Out of hours treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts of JPs and locum JPs to cover if someone is absent. Note, the noun surgery has 3 meanings. The building where JPs work, the practice is moved to a new surgery on the high street, a time when JPs see patients. Morning surgery is from 8:30 to 12:30, and the work of surgeons, the patient needs urgent surgery on a burst appendix. The practice team. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking requests for repeat prescriptions, talking messages for patients and other healthcare providers, and for filling and scanning documents into patient records. The practitioner manager has responsibility for finance and sometimes for ET, supervises physician staff, hires locums, and helps prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics, as well as one-to-one clinics for those who wish to give up smoking. In addition to practice staff, JPs work with a number of health professionals. District nurse visit temporarily housebound patients, such as recently discharged hospital patients, to change dressings, such as ulcer dressings. Health visitor visit families to carry out check-ups and young children, particularly under 5, to make sure they are healthy. Special attention is paid to families in need, such as those living in poverty. They also do baby immunizations. Midwives run clinics for antenatal patients. Physiotherapists provide hands-on treatment but also teach patients exercise they can do to improve their condition after an accident or operation. A JP's day. Dr. Stu works in a practice in a small market town with 3 other family doctors. The surgery is in the center of the town and is shared by 3 practices. This is a typical working morning when she is not the duty doctor, responsible for emergencies and urgent problems. 8 a.m. Arrive at the surgery. Check the OOH email printout. Check for urgent and non-urgent message. 8:30 a.m. Check emails from the health board and partners prepare for surgery. 8:30, 10:50 a.m. Morning surgery. 10-minute appointments. 6 pre-booked last week, 2 booked 48 hours ahead, 4 bookable on the day. 10:50, 10:55 a.m. Check with receptionist. Check with reception for messages. Sign prescription and deal with repeat prescriptions. 11 to 11:20 a.m. Coffee break in the conference room with colleagues. Then 11:20 to 11:30 a.m. Take home visit requests and divide up visited with. Okay, I cannot see that, so I'm gonna read it from my book. Sorry. It says. Oh, I cannot see it here either. So sorry. 11:30 a.m. to 1 p.m. says home visits. Medical Education 1, Unit 11. Medical Education in the UK. Medical education in the UK covers undergraduate education 4 or 5 years at medical school, the section for a university responsible for medical condition, a 2-year foundation program which provides training for new doctors after graduation through a series of placements in different specialties, postgraduate training which doctors take to become JPs or consultants, senior specialists, often delivered through colleagues from different specialties, for example, the Royal College of Physicians. Continuing professional development in the form of courses and seminars which doctors undertake throughout their working lives to keep up to date. Extract from an undergrad prospectus. The MBCHB, Bachelor of Medicine, Bachelor of Surgery, is a 5-year undergrad medical degree course. Most of your learning takes in small groups. The main components are core, years 1, 2, 3, an integrated program of clinical and scientific topics mainly present through problem-based learning, PBL, where you work with others in a series of case problems. Vocational studies and clinical skills. This component prepares you for the clinical skills required for contact with patients from year 1 of your course, through periods of practical training where you are attached to a hospital department or general practice. Students select models. Students select models as SMS allow you to choose from a menu of subjects such as sport medicine or even study a language as preparation for an overseas elective. A hospital attachment of your own choice between years 4 and 5. Clinical attachments for years 4 and 5. A series of 4-week clinical attachment in medicine, surgery, psychology, psychological medicine, child health, obstetrics, and gynecology and general practice. A student's view. Ellen, a medical student, described her course. I'm just finished my first year of medicine. What I like about this course is that you are involved with patients from the very beginning. Even in our first year, we spend time in hospital. Much of the course is PBL. We have 2-hour sessions a week where we work in groups of 8 to 10 solving clinical problems. We decide together how to tackle the problem, look at books and online sources, make notes, and discuss the case together. It's a great way of learning and getting to know the other students. In the past, medical students had lectures with the whole class taking notes from lectures from 9 to 5. Now it's mainly group work, although we do have some lectures and seminars where we work in small groups with a tutor. I like all of it, even the dissection. We get to cook up cadavers from the second month of the course. Medical Education 2, Unit 12, the Foundation Program. The Foundation Program is a 2-year training program which forms the bridge between university-level study at medical school and specialist or general practice training. It consists of a series of placements, each lasting 4 months, which allow the junior doctor, known as a trainee, to sample different specialties. For example, pediatricians. A 1-year, 1 trainee FI1 correspond to pre-registration house officer, post, and a year 2 trainee to senior house officer post. Each trainee has an additional supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate range of clinical competences, which are assessed through observation in their workplace. People in medical education, tutor, an academic, or in some cases a postgraduate student who leads tutorials. Demonstrator, in anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturer or senior lecturer. An academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor, a senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. Clinic trainer, a consultant assigned to a trainee who provides training during periods of direct clinical care. Educational supervisor, a consultant who supervises a trainee period of training. Medical qualifications: BMSc or BMADSCI, Bachelor of Medical Science, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MBCHB, MBBS, BMBCH, BMBS, Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. MD/DM, Doctor of Medicine. DRCOG, Diploma of the Royal College of Obstetrics and Gynecology. MRCP or MRSCS, member of the Royal College of Physicians or member of the Royal College of Surgeons. Doctors become members by successfully completing the assignment procedures in their college. FRCS, FRCSED, CSI, Fellow of the Royal College of Surgeons of England. Other colleges are indicated by the letters which follow, for example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends on their college. For the FRCS, further examinations must be passed. For other colleges, it is by nomination or work assessment. Unit 13, the overseas doctors. Types of registration. To manage and treat patients in the UK, all doctors must register with the General Medical Council. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is from doctors who have completed their year clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year medical training in the UK. A specialist registration is for doctors who have completed a specialist medical training and have a certificate of completion of training CCT. The GP register is a register of all those eligible to work in general practice in the NHS. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in the first appointment in a UK hospital. Part 1 consists of a writing test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination. It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. PLAB sessions and advice. OSCES assess the skills. Clinical examination. Your ability to carry out a physical examination of a simulated patient. An actor trained to play this role will be assessed. Uncomfortable or intimidating examinations will be carried out using a mannequin, an anatomical model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact with a simulated patient or in some case the examiner will be assessed. A skills test may include breaking bad news and giving advice on lifestyle. History talking. Your ability to take an accurate history and make a reasonable diagnosis will be assessed. Advice on the station from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the ABC, airways, breathing, circulation protocol in every emergency station. Keep in mind safety precautions like throwing the sharps in the sharp bin. Check the patient understands what is happening. Then ask them about any concerns they might have. Don't just give a lecture. Listen carefully to what the actor says. Note: sharps are needles and bottles which must be disposed of safely in a special container called a sharp bin.